It has been 3 months since COVID-19 booster doses became available in Ghana to adults. To date, an estimated 49,068 persons have accessed the jabs, which are recommended 5 months after the second dose is administered. Notwithstanding that, the United States Centers for Disease Control and Prevention recently announced that the protection from the third shot decreases after 4 months. This development necessitates a fourth dose to increase the antibody levels among vaccinated individuals to prevent them from becoming critically ill. The question is, should the world be prepared to get boosters for the rest of the SARS-CoV-2's lifespan, which is being touted as evolving from a pandemic to endemic format? Paul Chetty, a medical microbiologist who has been involved in the local fight to contain COVID-19, recently opined that with the emergence of new variants, COVID-19 shots could become mandatory annually, much like the flu vaccine and possibly for the rest of our lives.
I think this adds to the argument that this vaccination process may be a yearly one, where we need to update our immune response, so to speak, because we're going to continue to have, as long as the virus persists, we're going to continue to have other variants. And what that will mean is that our protection against a new variant will not be the same as what we had to the previous variant.
He said even though health authorities are taking ambitious steps to achieve herd immunity, it may not be attainable even with high vaccination rates.
We will always have variants. We don't have, if we look at Omicron or look at COVID in the same way that we look at influenza, we do not have herd immunity against influenza. Influenza is a yearly virus, you will always get it.
Herd immunity is achieved when 80% of the population of a country is fully inoculated against COVID-19 and there's a return of some semblance of normalcy similar to what obtained pre-COVID-19. Chetty further divulged that based on existing sciences, more infectious and non-lethal variants are expected to surface.
We will continue to have more infectious variants, not necessarily lethal variants. And the reason why I say that is there is a competitive advantage for the virus if it's able to spread faster among people. But that doesn't necessarily translate into having a higher level of lethality.
Ghana's transition from Delta to Omicron was first observed in December 2021 when the country saw a massive upsurge in new infections, deaths, and hospitalizations. Though the variant has still not been officially confirmed in Ghana, health authorities are certain that Omicron was behind the uptake. 20 patient samples were sent last week to the Caribbean Public Health Agency in Trinidad and Tobago for Omicron testing. The results are expected in 2 weeks' time. Around the world, other variants have appeared, including BA.2, a strain of the highly contagious Omicron variant. Deltacron, a combination of Delta and Omicron variants, have also been detected in Europe. Temika Rodney reporting for the HGP9 News.